In our previous video in this playlist, we learned about Part A, and now it's time to learn what does Medicare Part B cover. Part B covers your outpatient medical care. This includes many preventive services, which are covered at 100%. Some of the more common Part B preventive care services are bone mass measurements, cardiovascular screening, diabetes screening, depression screening, colorectal and prostate cancer screenings, flu shots, mammograms, pelvic exams, and a yearly wellness visit. Part B also covers ordinary outpatient care, services that are medically necessary to diagnose or treat various injuries or illnesses. These services include doctor visits, lab work, diagnostic imaging, medical supplies, and outpatient mental health care. If you catch an ambulance ride to the hospital, Part B covers the ambulance and the outpatient emergency room services. There are also some other rather expensive services that fall under Part B, such as outpatient surgery, physical therapy, transplants, chemotherapy, radiation, dialysis, oxygen. Part B covers durable medical equipment, such as hospital beds, crutches, walkers, and canes. It covers diabetes supplies, such as lancets and test strips, insulin pumps, and glucose monitors. Also, when you receive a medication that is administered by a medical professional, this drug will fall under Medicare Part B instead of Part D. We see this commonly with immunosuppressive drugs and other injectables that treat autoimmune conditions or similar illnesses. Now, maybe you have a question about something else that Part B covers, so I want to give you a couple of resources before I tell you specifically some things that Medicare Part B does not cover. First, you can join our free private Facebook group called Medicare Q&A with Boomer Benefits. My team and I are in there 365 days a year answering questions from Medicare beneficiaries like you, and you don't have to be a Boomer Benefits client to join the group. We have built a rich and vibrant community there where Medicare beneficiaries even help each other with common coverage questions all the time. You can also visit www.medicare.gov/coverage, where you can type in a service or a test and let Medicare's directory provide you answers. When you receive Part B covered services, you will pay a share of the cost just like you do with Part A. There's a small annual deductible, and once you have satisfied that, Medicare covers 80%, you cover the other 20%, and this is called your Part B coinsurance. There is no cap on your 20%. You pay that forever without limit, which is one of the reasons why Medigap plans were first created to help pay that other 20%. There are also some things that Medicare doesn't cover. This includes routine dental, vision, and hearing services, concierge care, custodial care, cosmetic services, massage therapy, or routine foot care unless you have a related condition that requires it, like diabetic neuropathy. It also does not cover hearing aids or fittings for them. You should be aware that outpatient services performed by providers who have opted out of Medicare are never covered. We find that people new to Medicare are often worried about the things that Medicare won't cover, but other than these few exceptions that I've just mentioned, most medically necessary outpatient care will be covered under Medicare Part B. Now, it's your choice whether you choose to stick with original Medicare and add a Medigap plan, or you could choose to enroll in a Medicare Advantage plan, and that leads us to the next video in our series, which is all about Medicare Part C, the Medicare Advantage program.